Welcome back to Sports Medicine on Tap. My name is Brandon Align. I'm sitting at Neck of the Woods Brewing Company with my good friends Dr. Frey and Dr. Brad Bernardini. Gentlemen, welcome.
Hello.
Thanks, welcome back, Brad.
Thank you.
It's been a while.
It's been a long time.
I think
Has it been that long?
Yeah, it's been a very long
I
time.
think it's been about since August.
Since you guys have asked
Seriously?
me back. Yeah.
Well, I mean, that last episode you
It was
were
bad.
on?
Didn't get good ratings.
Yeah, I know.
It's all about the ratings.
Well,
It's all
ironically,
about the 5-star ratings.
I do believe you were on for the Hollywood Brown SC joint
Was that it?
dislocation episode, and
Yeah.
we were all wrong. We said that he's all not coming back that season, and ended up coming back late in the year or whatever the case was. But,
Nailed it.
Nailed it. Classic. Before we go ahead and get into tonight's episode, we just want to give a quick shout out to our sponsors, Virtual Orthopedics and Spine. They have you covered from runner's knee to dog walker's hip to yard work, back, and laptoppers. They have a doc for that. So find the right specialist for you at virtua.org/ortho.
Is there such thing as dog walker's hip? Is that a real thing?
There is now.
Wow.
You walk your dog a lot and see what
Yeah,
happens to
I
that
know.
hips.
Yeah.
No leash.
No leash.
That's what happens. You chase
Yeah,
after your dog
that's
and you're not
maybe.
supposed to be running no more.
I never known that was a thing, but that's awesome.
You know what helps dog walker's hip?
But
Sourfest.
Sourfest.
Yeah.
sour.
So, as we mentioned in previous episodes, on May 17th, which is this upcoming Saturday, if you're listening to this on the day it debuts, it will be tomorrow. May 17th here at Pittman at Total Turf, they have their Sourfest from 12 to 8 p.m. You can go online and pre-order some tickets as well. They have all kinds of sours. I will give you I don't know if I'm allowed to say this or not, but I went in the back and tried some Orange Crush Sour before we started the show.
Yeah.
Tastes just like orange soda.
Wow.
Very good.
Wow.
All right.
You guys were like 5 minutes late on that
Yeah,
one.
shit.
Damn it. I was on the phone with my cousin. I haven't spoken to her in a while. Blew it.
So, ironically, as things would have it, last time we were on, Dr. Frey, where I was mentioning just how like this time of the year is generally kind of slower for topics to kind of arise. We took last week off just because our schedules weren't matching up and we didn't really have a topic. And then within the last week, we got like 5 decent topics to kind of go all of them. Instead of just picking one of them, we're going to kind of cover all of them in a sense. And we're just going to have a general discussion on a little bit of everything tonight. It's going to be kind of all over the place in a good way.
Yeah.
Awesome. Yeah. So one or two of them we can really dive deep, I think, a little bit, but we'll try not to, giving us time to try to get through them all.
Yeah. So I think we'll start in kind of like chronological order, in the order they happened.
Sure.
I think going back until May 5th,
Yeah.
on good old Cinco de Mayo, the rookie from the Reds, Tyler Callihan, was trying to go make a catch in the outfield towards the outfield wall. It was kind of like in the foul territory area.
Yeah.
And he ran straight with his glove hand into the wall, and it went right like a wet noodle.
Yeah.
Right away, and he kind of went right to the ground, held
Yeah.
his arm, kind of sat himself up, and he knew it was no good from there.
That was one of those injuries. We've talked about doing like gruesome injury episodes, right? Like, and that was one of those injuries I feel like would qualify for that.
Yeah.
Like, you see it flopping, you're like,
Oh yeah.
yeah. That's bad
Dramatic video if anybody hasn't seen it. And
Yeah.
it was a little hard to tell. It happened kind of fast. I was hoping to get like a slow-mo version of it, whether it was an upper arm or a lower arm injury, but it turns out it looked like it was a both bones forearm fracture.
Lower, yeah.
Yeah, that's what I believe he had surgery on, and that's what the report said. It was both ulna and radius in his forearm.
So tell us about that in an adult.
Yeah, I mean, fairly super common injury in kids,
Yeah.
right? Almost always non-operative in kids. So in my training program, we did 6 months at the Connecticut Children's Hospital, and I had this summer rotation, which was like the kiss of death because
Right.
kids are falling constantly, and this is something that we were probably taking care of 3 to 4 times a night.
Right.
Generally involves kind of a little sedation, and you kind of bend it back. Kids' bones are bendy, so they bend back into position, and cast or splint depending on the severity of it. And kids do well. Adults, unfortunately, crack and shift, and so typically this is an operative problem because both of these bones end up shifting into a position that no longer gives the forearm any kind of structural integrity. So typically we're doing something called an open reduction, internal fixation. Basically making 2 incisions,
Right.
approaching each bone individually and putting a plate and screws to kind of stabilize the bones until they can heal.
Yeah. So same thing. Like we spent 6 months at CHOP and at Children's Hospital, Philadelphia.
Yeah.
Same thing. Like I went like over 100 ERBs, and you're like, oh my God, it's just me. They're busy nights.
Yeah.
And but for kids under the age of 10, Sometimes you got to do like a little rod in there, a little Nancy nail. But generally, the thicker periosteum, much more stable. Like you usually get away with that surgery. For adults, it is the way it looked on that injury, right? Like, it is just floppy.
Yeah.
And so typically, you, just like you said, you always have to do surgery. So going back to the residency days and going back to that trauma, which we don't really do at this point anymore. We typically hand that off to
you're
our
going to be doing
trauma
a little
partners.
bit. We're going to have you do a little bit more calls.
Yeah, we'll see about that, my friend. So for those particular calls, how are those fixed? When, like you said, open reduction trauma fixation. Like someone fractures a tibia, we stick a rod in it frequently. What happens with the forearm?
Yeah, so the forearm, not as it's a smaller bone. They're different kind of structure from a kind of a what we call the intramedullary canal standpoint.
Yeah.
So there's not a lot of room for rods that go down the center like there is in a femur or tibia. So typically we have to put a plate on the outside. These plates are pretty low profile. They're kind of meant to fit on these bones specifically. Sometimes we have to kind of bend them a little bit to mold the bone. And then usually three screws on either side of it to kind of stabilize.
Yeah.
And that hardware typically will stay in place.
Yeah.
Forever. Again, there's usually 2 incisions, one on the ulnar side, which is basically the pinky side, which is kind of a direct approach.
Yeah, that's easy. It's right there.
Yeah, the other approach is in the forearm. The Bowler-Henry approach, that's a little bit scarier. There's a little bit more anatomy there, some nerves and things you have to kind of push to the side. Yeah. But yeah, pretty straightforward for people that are doing a lot of it, and for our trauma team, and Steve, who's taking a lot of call for us, they do really well.
So it's funny. I agree with you mostly on that. In all honesty, so I feel like the forearm's tricky, right? Like. Because the forearm, typically that's how we think of most fractures, right? Like, especially long bone fractures like that. You get it to heal. As long as you get it to heal, they're going to do fine. Yeah. And it's just got to get it to heal. But there is an articulation. There is a symmetry between the radius and the ulna, right? The ulna is sort of like your single spot, and the radius rotates around the ulna. Yeah. And because there is that symmetry or that the codependence there, people will lose.
Yeah.
Frequently, a little bit of grip strength or a little bit of pronation or supination. It's like almost 20 or 30% on average will lose a little bit. And for you or I, in the vast majority of the world, not a big deal. Mm-hmm. This could be a problem for a baseball player.
Yeah, it's his glove hand, right?
Glove hand,
That's very helpful.
Yeah, preferable.
Yeah,
right?
Yeah.
But yeah, I mean, if it's your dominant arm, for sure. And the higher the, if you're a pitcher, that's really bad.
Really bad.
If you're an outfielder, maybe not as bad. But I mean, it can, for sure, can affect things. I don't think it's going to affect his ability to catch.
Right.
I mean, I think from a glove hand perspective, he should be fine.
Yeah.
But yeah. And then, there are variants of these where you can have injuries to the joints above and below, and those are complicated. And don't start that. We maybe shouldn't dive into that.
Galeazzi,
Essex Lafrezzi. Yeah. So anyway, so those are much more complicated. And you always wonder about little subtle joint injuries.
Mm-hmm. Right.
When you have a fracture of a long bone, there still can be some damage to those joints above and below. You don't always see evidence of that at time 0, and sometimes those things display themselves later in life or down the line.
Yeah.
Hopefully he's through his career at that point. But yeah, he's young, right?
Yeah.
So, rookie. So
he's a rookie. It was the 29th prospect.
24 years old?
Yeah.
No, he's 24 years old.
He was the number 29 prospect, I think. So a pretty high level prospect coming in.
Yeah, I think with that being said too, it's like, what's his? We could talk about his return. I mean, it's still really early in the baseball season, so good chance he comes back.
Yeah.
So they put him on the 10-day IL initially, and I was like, what?
Yeah, because that's what's going to need 10 days.
Right.
For that thing to heal up.
Incisions heal.
Incisions heal.
Stitches come out. That's about it at 10 days.
Get back out there, kid.
Good luck.
You're young.
Good job.
No, I would anticipate at the very early, especially for baseball, right? Like I would anticipate at the very earliest 3 months. So maybe there's a little bit of the season left.
Yeah, I think so.
Yeah.
Maybe earlier than 3 months, but 3 months is definitely a safe estimate.
Right.
Yeah, and I don't know much about the Cincinnati Reds lineup where they use him as DH and kind of limit him coming back, and they can get a little bit more out of it in theory, I guess, earlier on versus playing the field.
I wonder how much that will actually impact them hitting. Like lots of times, you're like, all right, we'll let you hit. It's not going to be as much of an issue. but they're like it's a little bit jarring. And then also,
and there's
with
some
that, if you
rotation there.
lose
Yeah,
that-
I was gonna say that rotation, turnover of your
that's
hands and wrist.
where that could potentially be an issue for him.
Yeah.
In all probability, I think that he's going to be fine. He'll still have the same good career that he was supposed to have.
Yeah.
But I hate to say, I think there is a little bit of risk that this impacts him, and it's not quite what it was supposed to be as a byproduct of this particular injury.
Yeah. You think he runs after that ball next time?
I think he slides a lot earlier next time.
That's
you
going
know?
to be in his head.
I think he pulls up a little bit.
That or I don't know. Do you put him in center field so he doesn't run into the walls on the
I
sides of him?
don't
again?
think he's ever run into a wall
Yeah,
again.
no.
Well, now that he can't throw, no, I'm joking.
Oh.
Yeah, so we'll see. We'll keep tabs on that on Tyler
but
Callihan's situation.
I'd rather have a fracture than a soft tissue injury in the upper extremity.
For sure. Yeah. A lot more predictable in
Yeah.
terms of return.
Yeah.
Yeah, that's for
absolutely.
sure. If it was something,
And I'm
else.
sure, so anything else you do for him? So I had a couple patients today ask me about peptides.
Yeah. A
And,
lot of people are asking me about these
It's a
things.
hot topic.
Very much so.
Healing, augmentation and things.
What's your
that they
answer
get.
on that?
I have a very vague answer
Yeah.
about that. So anecdotally, I think there's some reasonable
Data?
Theories, ideas.
No, I don't know what
Concepts?
to call that. Stories. Reasonable isolated events where people have said,
Anecdotal.
anecdotal. I've taken this. It's worked. I feel better. I healed more rapidly than my friends who didn't. I don't think we have good literature or data on it yet.
Yeah.
And we've always made evidence-based decisions, and
Right.
I think we
Right.
kind of wait. And so that sometimes frustrates patients because they want the most cutting edge,
Right.
up to date
Right.
kind of stuff. And if you're really evidence based, you have to wait until that stuff has proven itself.
Right.
Which at a minimum is like 2-year study, follow-up study. So I tell people, we don't recommend brands. We don't vet. This is really poorly followed by the FDA. There's really not a source that you can rely on that isn't potentially tainted with other stuff. I used to work with the U.S. ski team, and we had a kid that get kicked out of the World Cup because he took a supplement that was legal, but evidently it was made in the same lab as a supplement that was not legal according to like WADA restrictions. And so he got kicked out because he tested positive for this thing and it came down that, that this lab was they were batching this stuff in different, and they basically dirty batch.
A little bit of contamination.
A little bit of contamination. So,
Life-altering.
I tell people you never really know what you're getting. You got to really do your research to try to find at least some kind of vetted source. Even then, you don't know what you're getting. And right now, it's more theoretical than proven. Probably not going to hurt you if you take, if you take it in a short, rehab recovery period. So that's kind of my answer. I don't know.
It's a better answer than I am. Yeah.
You just say no.
No, I say like right now there isn't really data to support it.
Yeah.
And I say same thing. Like probably not going to hurt you.
Yeah.
If you're deciding between I can feed my family with this loaf of bread or I can buy the peptides.
Yeah.
Feed your family. Right.
Yeah.
But if it's not a big deal and you want to try it, it's probably not going to hurt you. That's typically what I say.
Yeah, there's some people doing PRP injections for fractures and stem cell and again, maybe some of this. There's actually a little bit of
there is some data for that.
Data for that. So you wonder if he's getting stuff like that.
Right.
So maybe he will be back in 10 days.
Who knows?
You never know, right?
Yeah.
Right. Yeah. And it's again, I don't follow the literature on forearm fractures quite as much. Both bone forearm fractures, but one of the classic concerns with the both bone forearm fracture. One of the reasons why we still typically use 2 incisions is something called synostosis. You can get extra bone growth, and then sometimes you can actually get some bone growth from one bone to the other.
Fuses.
It fuses. And that's a real problem.
Yeah.
And so I would almost wonder, or have a little bit of concern if you start using BMAC or different things that are
Accelerate.
PRP that accelerate healing. Is that a risk? Is there a high? So I don't know. I think that would be one area where I would, unless the data is already there, where I would just be a little more cautious.
Yeah, he's a
about
young,
using
healthy
those
kid. There's no
supplements.
reason to believe he's not going to heal.
Right.
Just treat him
they tend to heal like bench, and it wasn't open, right? So an open fracture.
And that's a good
has
point.
bigger
Like
problems.
sometimes you try to do too much.
Right.
You try to do this, all these different, kind of supplements and augments, and you don't need to.
Yeah. Just let nature run its course.
But unfortunately, in this country, in this day and age, a lot of people feel like if you're not doing it, you're not taking the best care of them. And that's why I think traditional medicine is almost getting a bad rap now in some
at
days.
times, it's very frustrating.
Yeah.
Right.
But
right.
you know what? They'll live with the decisions they make, and we'll continue to do the right thing and go from there.
And I hear like very, very smart people, very intelligent people kind of spewing, TikTok medicine, and you're like,
TikTok medicine's a real thing.
Well,
It's hard.
but you also make a lot of money from TikTok medicine.
sure,
You
yeah,
know?
yeah.
There's a lot of people. A lot of people are willing to pay cash for what they deem to be, cutting edge, accelerated, medicine outside of the traditional, all those doctors in the white coats don't know what they're doing,
Right.
kind of thing. So, are we getting down a rabbit hole right now?
I think we are.
Yeah.
Yeah, a little bit.
Let's pull us out of the rabbit hole.
Sure.
No, but I think to kind of cap off the discussion in regards to this and then all the peptides, the stem cell, all that stuff, I think it is like a higher or hotter topic in the world of baseball too, at least in the college levels of like these kids are, in the world of baseball, every little inch, 2 miles an hour extra, whatever the case is, all these different things for recovery and all this stuff is such like so focused on.
Yeah.
And then, but again, these young kids, they don't know the safety of it, like you mentioned, and they take it and they ruin their collegiate careers for something silly. Where it's like you could have just did it the old school way, and just worked really hard and give it some time. And
tried and true.
Yeah.
Proven,
some things
ways.
are there for a reason. It's they're tried and true. They've been around for a very, very long time. You don't have to outsmart those things.
Right.
Yeah. So to go on to our next topic, so that we were covering a story from the 5th and now on to the 6th. Was a story out in Ohio for a tragic event that happened in Ohio lacrosse in the high school setting. A young 16-year-old high school lacrosse player named Dylan Veselic took a shot to the back of his head during a game. Was on a Tuesday evening, which I believe the 6th was, and then was transported to the hospital. He was at one hospital, then got transported to a second hospital for surgery.
A larger trauma. Yeah.
And then unfortunately after the surgery, 2 days after the incident, he unfortunately passed away from his injuries on the lacrosse field, and which is just a crazy story. I played lacrosse almost all my life. Your son plays lacrosse now.
Yeah, I played when I was in high school.
Like that stuff that you don't think about, those kind of things, like taking a shot off your body somehow. Unfortunately, he took it to the back of the head, which is a little bit of a susceptible area, which doesn't have that much coverage on a helmet per se.
Right. We'll talk about that in a second.
Yeah. So what do you guys think about that one? It's a crazy story.
Scary.
Freak event.
Yeah, like a sort of reality check. Freak event, 100%.
Yeah.
Freak event, very strange thing, but it is scary. My son's a goalie, right? Like he's taking.
They're shooting at him.
They're shooting at him, right?
Right.
And I give him a lot of credit, man. He's a tough kid. I give him. He's a tough kid, and this was not a standard thing. This was a freak event, but stuff happens, man.
Yeah.
Like there is risk with sport.
Mm-hmm.
We don't know any of the details on this. And here's our disclaimer, right?
For sure.
We don't have details of the medical charts. We're just sort of taking these injuries as a launch pad for our talking points.
Right.
So we don't really know exactly what happened. What do you think was the actual injury that this kid sustained that might eventually lead to his death?
So look, I think again. Disclaimer: we're orthopedic surgeons. We're sports medicine specialists. We're like shoulder, knee doctors. We're not neurosurgeons. We're not head doctors. But we see sports injuries, and I think I had to do a little research on this because the classic head injury is not like ball hits head. It's like high energy trauma with like car accident, fall from a height, things like that. And the common things that we think about. The thing that I think about, we think about these hematomas in the brain. So a head injury, direct blow injury can cause bleeding internally in the brain. There's not a lot of room inside the skull for swelling.
Right.
So those bleeding events can create swelling inside of the skull.
I call it compartment syndrome of the head.
Yeah.
Yep.
Of course you do.
Yeah.
And then that starts to push back on the important soft, squishy brain matter, and that brain is important, right? So it's responsible for everything, from our personalities to our decision making to our, our vital kind of
breathing.
Yeah. At the lower, more primitive levels are just our vital, signs and breathing, heart rate, and all these things.
Yeah.
So the first thought is, did he suffer a brain bleed or an internal hemorrhage in his? And there's an epidural hematoma, which is kind of this classic, injury where you have a rupture of there's a classic artery in the brain, middle meningeal, artery that ruptures, bleeds. Arteries bleed with a little bit more pressure. They create a little bit more of a fast, developing situation.
Right.
people are usually okay for a brief period of time.
Yeah, lucid interval.
They're
Right.
okay for a short period, and
The-
then they
the-
start
the-
to have mental status alteration. They start to change, and if you don't get there quickly enough surgically and decompress that bleeding, then people die.
Rapid deterioration.
Very quickly.
Yeah.
There's another version of it, subdural hematoma, which is a vein injury. Veins don't have the same pressure. They don't build as fast, so they're more slow building.
Yeah.
Those are usually things you see in old people.
Yeah.
Right?
And that's under the dura mater. Like
Yeah.
it's just, you have your brain, you have this thick casing around it, the dura mater, tough
Yeah.
mother, right? And then you have your skull. And if you bleed between the skull and the dura mater, then it's like this, you get this bulging out, and on the CTs like this common crescent form and that's what squeezes the brain.
Yeah.
Or you can have a hemorrhage that's below that level.
Yeah.
And then it's not coming in with the same pressure, and two, it's kind of spreading out everywhere. It's not just direct pressure in this one spot.
Right. Yeah. And then doing some additional research, there's all these other things that can happen. I mean, if you take a bad enough shot to the lower aspect of your skull, it can actually shift your skull spine relationship. It can cause vessels in your neck to be severed. It can cause a brainstem injury, which is where all our kind of respiratory centers are and these important things. I mean, the fact that he got rushed from one hospital to another and then had a procedure leads me to believe that he had a bleed.
Yeah, that was my thought. Is that this is epidural.
And then they were they diagnosed it, the first one. They didn't have the docs or the surgeons to do it.
Yeah.
Maybe it wasn't a level 1 trauma center.
Probably.
And then they sent them to a place where they have the specialists. And it may be that, by the time.
And where that is, like you said, the parts of your brain that are responsible for these really basic functions,
Primitive
the stuff
functions.
the
The stuff
primitive
that keeps
functions,
us alive.
breathing, your heart ticking, like all these different things that don't take any thought, they just happen. That's all at the brainstem, right? So if you have pressure at that level, it's devastating. And we have no idea if that's exactly what actually happened, but my gut is that he got hit in the back of the head, base of the neck, kind of base of the skull, not where the lacrosse helmet is covering him. We're going to talk about that in a second.
Yeah.
And caused an epidural. And I think the two things that you touched on are, well, the one thing that you touch on, there's two different names for it. Some important things to know about, right? Like that lucid interval, or the slang or vernacular is what they call it, talk and die, right? Like it seemed like they were okay for a little while.
Yeah.
They can speak with you and everything, and then everything deteriorates really quickly.
And that's a tough one, right? Because you have to have a high index of suspicion for that. You have
That's
to really
exactly
be,
right.
you
Which
have
is
to
why
think,
I'm mentioning it.
Yeah. You have to say this guy took a big hit.
Yeah.
He seems okay now, but we need to get him. We need to get
this looked at.
somewhere. Yeah.
And so then some of the other signs and some of the other symptoms for this, in this particular scenario, right, for skull lower or basilar skull fracture, there's a few different things. One is that they call it it's the raccoon eyes, basically. So you can get bruising all around your eyes, and then there's battle sign. You remember what battle sign is or no? There's something called a battle sign, which is similarly you get bruising behind the ears.
Yeah.
If you start seeing that stuff happen, like
something bad's happening.
go, like something really bad is happening, exactly.
Yeah.
And then there's you can actually get otorrhea or rhinorrhea, which is CSF. So your cerebral spinal fluid leaking from your nose, or even leaking from your ears.
Yeah.
Again, anytime you have something like that draining from your nose or your ears, hospital. Like you don't wait around on that sort of stuff. And then like there's this classic sort of head trauma, fatigue, like dizziness, not really sure, like confused, like those things start happening.
Somebody who doesn't appreciate the severity of the injury may think, he's a little concussed, or they got their bell rung, and maybe we'll check him later. Yeah. And then they come back and he's unconscious.
And then so that's the other, eyes on all the time.
Yeah,
like you don't want to take you don't want to take it, and it happens relatively quick, right? Like it does, unfortunately. The arteries are a high pressure system, so they're pumping fluid in there.
The brain gets a lot of blood flow.
Yeah, that's exactly right.
Yeah, so I mean, it's definitely something that you never really want to see, but it's unfortunately like like you said, freak accident, but something that happens all the time. There's always a defender or someone in front of someone who's shooting a lacrosse ball, and you kind of just duck and turn to the side a little bit.
So I was a football player. I had full head coverage with my helmet.
Yeah.
It didn't necessarily stop concussions and whatnot.
Right.
You definitely have of course, that's something we've talked about multiple times.
Yeah, I'm paying for that now, and not so much back when I played. But so speak to the lacrosse helmet.
So yeah, it's again, I played when I was in high school. My son plays right now.
Were they leather helmets then? Or?
That's right. Yeah, leather helmets. How'd you know?
I remember.
Right. I remember. Well done. Thank you. But yeah, so I watch an awful lot of lacrosse now, and I love it. It's awesome, right? And I've asked myself, looking at like these kids running around out there, like, why is it so weird? Why do they have these weird looking helmets? Like, is it just part of like lacrosse trying to have its lacrosse identity?
Culture.
Yeah, and its culture. Is there an actual functional advantage? It's a smaller ball. They need to have better range of motion of their head to be able to follow the ball and track the ball and better range of motion. But like, it is very strange that it goes from pretty high up in the back of your head, and then it does come way down in the front, which is obviously important. That's where the ball is usually going to be coming. But I've literally had that thought in my head in the past. Like, it's very strange. And and you compare that to a hockey helmet, again, almost like nothing, but it comes down a little bit lower in the back.
Right. We're not a lacrosse or hockey family. Is there any specific direction the kids get to not turn their head? I mean, is there a, hey, don't keep your eyes on the ball, face forward, don't turn your head?
No,
have you ever gotten that?
I've played defense and I've never was instructed how to fit. Like, you just kind of instinctively
did what you did.
Just kind of tuck to the side.
Yeah.
I always just rotate to the side and cover as much as they can.
The vitals.
Yeah. And then it still doesn't help. Like, I've taken shots off the head, off to like the different spots where you don't have a little bit of pounding, and it hurts. Like, I think the worst one was one like off my collarbone. I was like, oh, that was just straight. Yeah. He was like right dead on in front of me, nothing.
High velocity of those balls.
Yeah. And granted, I'm not, high school, they're probably shooting in the high 80s or so, give or take.
Typically, yeah. And then really hard shooters are going like 95 and whatnot. Yeah.
And those kids are like outliers, and I don't know whether it was a varsity JV game that the young athlete was only a sophomore.
He was 16.
I thought it was a varsity game, and he was 16.
I think it was as well. Yeah. But like some of these guys also it's one thing if you're snapping off a shot, and it's another thing if you're taking like this step down shot, like you're really stepping into it and like firing away.
Yeah.
And I didn't see the actual replay. I don't even know if it exists. And in my head, I'm wondering, like, did he turn to try to avoid, like, protect his body, and just take the shot off of the side? Or was it a scenario where he was defending a kid?
Yeah,
and like
didn't see
posting
it
up, facing the kid, and not seeing the shot coming from behind.
Yeah, or exactly.
Yeah, and it's just really bad luck. Yeah.
And I think to go off of what we were talking about the helmets too is a bit about the culture. Is that the cool thing to do is to have your helmet lid as low as you can to kind of get like that, but in that tilt, it raises it up in the back a little bit. I think a lot of people who play outdoor lacrosse, they have that's the cool thing, to have your tilt reeled down so you can see at the very, very top, the crossbars. That's like the cool thing to do.
Sure.
And I've noticed that like over time that people just wear their helmets so low, which is okay. I'm okay with coverage in the front, but then it just lifts it more on the back.
Do we think this changes the helmet design of
I wonder. Lacrosse? I don't think it will. But
has this happened? Do we know? Has this happened before?
I would imagine it. I would assume it has.
I know that I gave a talk once on like abdominal injuries and lacrosse abdominal injuries for like you get hit with the ball in the spleen or whatever. And there's not much you can do about that necessarily. But I mean, scary to think that it doesn't maybe make people think about helmet design a little bit.
Right.
I mean, that's potentially avoidable if you have the right equipment.
For sure.
Right?
Yeah.
Doesn't happen with a football helmet.
Right.
Yeah. It is. It is. And like I was saying though, I don't know if there is somewhat science behind it, just like we're talking about.
Yeah,
right?
sure.
Is there a give and take? Yeah, we can make this a little more protective against this one incredibly unusual, rare type of an injury.
No, I totally get it. Yeah.
But at the same time, expose people to other types of injuries because now they can't track the ball as well.
Yeah.
You know what I mean?
Yeah.
So there's a give and take of it. I don't know if that science, has gone into the decision making and the creation and the.
I think there's something to be had with that too, because I mean, the game of lacrosse is generally the same, if you will, indoor outdoor, but there's different equipment. Like for indoor lacrosse, helmets are essentially hockey helmets with cages.
Oh, is that right? Really?
But they're not like, you don't see people wear those outdoor helmets inside.
Yeah.
Like it's not, you don't cross that over.
Strange.
You have a cage helmet for indoor lacrosse or box lacrosse.
Right.
But outdoor, you wear the helmets that we typically see in the ones that we're talking about with the long cages and stuff like that.
The goalies are totally different, right? Like the goalies are like totally padded up and they move like an inch.
Yeah. It's good.
Right.
Yeah.
Yeah. So I mean, it's curious. I'm curious to see if there will be some stuff.
I'm sure somebody will think about it.
Yeah, someone will probably get some things underway with that, and hopefully something comes of it. And see what happens.
Sad.
Yeah, very unfortunate that those kind of things take. Terrible. That's what it takes to make a change. But
sorry.
Again,
for that family.
if that's 100% thoughts and prayers for that family, because that's just completely unfortunate. But we'll kind of see if anything comes of that, and then go from there.
Yep.
To go down our list some more here, our next event is we talk about the soccer injury in the National Women's Soccer League. Angel City FC Savannah King, a 20-year-old defender, went down and collapsed on the field with what's being reported as a medical event. And it was reported she collapsed after the 74th minute of the game, was attended to on the field for about 10 minutes, and then was taken to a hospital and was reported to be stable after that. And with that being said, I believe at the time of the incident, Angel City was up 1-0, and then they continued the game, and that's what I found.
That was a little controversial.
And that's kind of what
they
a lot of articles.
They polled the teams, though.
Is that what they did?
Yeah, they polled the teams, and the teams agreed to move forward. Yeah, and then afterwards, one of the coaches commented that maybe that was the wrong decision,
right?
Because they were affected by it, right?
Yeah.
So it's true, right?
Yeah.
So in retrospect, those decisions I think are easy to make. Somebody had a severe injury,
right.
and somebody, should we have kept playing? This person's could have been really injured, but at the time, as having been in games where people have been carted off on carts, and they're like, okay, coach, what's the next play?
Yeah,
we're ready to go.
Yeah.
I don't know that I look back on that and think that, you did the wrong thing. We should have stopped the game and joined in a circle of prayer.
Right.
People get hurt, right? Yeah. That's what we're here for.
Right.
And you don't really always know how severe those things are at that moment.
Right.
Now, I saw the video of this. I heard mixed reviews. So what I first heard was collapsed on the field, required CPR. Actually, the article said apparently required CPR. Now so we don't know. You don't always know.
A little bit.
Real
vague.
CPR is very, very obvious.
Right.
It's aggressive. It's very rhythmic. It's dramatic. People know what's going on. In this day and age, they probably try to do what they can to hide that from video and media. But the video, to me, I didn't see it close up, but it looked like she grabbed her abdomen, sat back, and rolled onto her back. So it wasn't like a face plant collapse. Like I went from conscious to unconscious down.
Right.
There's actually some video footage of people who have had cardiac events, and there's a very predictable way that they fall. Actually, so very often they'll drop to their knees, they'll clutch their chest, and they'll face plant. Out face plant, like break your nose face plant. And for whatever reason, that's a predictable way that people collapse when they have a cardiac event. Unless there's a contact, involved. So, but she looked like it was a controlled, I got to lay back, something's not feeling right. And then she was interacting with a player on the field. So that suggests to me that this wasn't a cardiac event.
Right.
So it was kind of concerning to me here that there was potentially, resuscitation happening. So then it makes you wonder, really, really,
what was it?
What was it? Yeah. Was it like an abdominal injury? Was it a soft, organ injury, or solid organ injury where there was like a bleed? Was she having a, bleed, and then she went unconscious because she was bleeding inside? I don't know if there was trauma before that. I don't know what the rest of the game was like. So there's a lot of things that this could be.
There's definitely a lot of gray area, and I think it goes with everything we talk about. We don't know. We don't,
Sure.
Right.
It was just one of those stories. Like, this is real crazy. Something that happened like that.
But again, I think
she's okay now, right?
Which also suggests
that
this.
Stable,
But it also is one of these things for sideline doctors, athletic trainers, PAs, whoever's covering these events. You have to have a high index of suspicion for what is the potentially worst case scenario that could happen here, and not just be too cavalier with some of this stuff, because things can change quick.
Right, exactly. And like we've talked about with the head injury, and then something like this, it's like things can look okay, and then all of a sudden not okay.
Same thing with a solid organ injury, right? It can bleed out. Spleen injury can happen pretty quick. You get hit hard, fast. You feel good for a little while. Meanwhile, you're bleeding internally. And then you get to a critical point where you're no longer able to stand. You have to lay down, and then all of a sudden you're unconscious.
Right, and I think there is a little bit of an overlap when those systemic things happen. Like the body just shuts down, and it presents generally the same way, if you will. Like your hysterical, you're kind of incoherent, and the next thing you know, you're unconscious. Of
Yeah.
it.
And the other kind of common thing that I think is it works against a caregiver's judgment is that especially pro athletes, they're so highly trained and their cardio is so strong that they can compensate for blood loss way better than your average individual.
It's like a
so
cliff.
they may not show signs of really like critical vital signs until they crash.
Right.
Yeah,
And
some
now all of a
people
sudden,
deteriorate. And some people go to the edge.
some people go to the edge and crash. That's exactly right. Yeah, and that's even worse with athletes, right? Because you don't see these early signs. It's not gradual. It's all of a sudden something
It's
bad.
not a zero entry pool.
Yeah, exactly.
When I was in med school, one of my good friends, one of my buddies, flag football. Playing flag football at the end of the game was like, something's not right. Like, I'm not sure what it is. Something's not right. And he's like, and we're like first year med students, like we don't know anything, right? And like he had a collision or something, or like flag football, right? And he's like, I'm gonna go to the ER, and I remember thinking to myself, like, why would you ever go to the ER? Like what? Yeah, and spleen lack. And like
and you guys let him go by himself.
Oh yeah, we had no idea. I know. Good time.
Good job. Good luck. Go walk there.
We continued to call him Spleen for the rest of his med school career. Of course, like a bunch of idiots.
Yeah, spleen's bad.
Yeah.
Never want to see that. So let's see my day of dates here, and then the next one would be discussing what we kind of started this topic of our, talking with you and I, Dr. Frey, about our discussions is the big announcement from the NFL that Derek Carr, the quarterback from the New Orleans Saints, is hanging it up and calling retiring after it started off, I think, early in March. It was reported that he had a shoulder injury.
Yeah.
His season was in question. The Saints might be in trouble, blah, blah, blah. And then a couple weeks later, I think it was on the 10th, I believe, a couple days ago, they announced that he's officially retiring. He's hanging it up. And then with the reports that it said that he was, for a little bit of background, he didn't finish his last season. He got injured on December 8th. He fractured his hand and had a concussion. And then he started to ramp up his workouts, and I think sometime in March. And then it was reported that he had a labrum tear and some significant degenerative changes to his rotator cuff. He attempted injections and rehab, had no improvements. And instead of undergoing surgery that would end up costing him the whole season anyway, he decided to retire.
Yeah.
So a little bit to break down into that, and kind of like to pick
bunch
through.
Of little steps there.
Yeah, a bunch of little different things that kind of what the articles say that we can kind of dissect a little bit.
Read the tea leaves here for us. What's your interpretation?
Old quarterback, made a lot of money.
Yeah.
Doesn't want to necessarily go through complicated surgical intervention. Probably okay when he's not throwing the ball and practicing against beasts.
Yeah.
Right. And just ready to go.
I wonder if he has a problem that is even fixable in that sense.
Yeah, it could I totally agree. So let's go through a couple scenarios. He's got degenerative labrum tear, which almost all throwing athletes have at the pro level.
Right.
Labrum is basically this kind of
Do you think that would be like
game
holding
changing?
them back? Yeah.
No, they hurt, but you pretty much you do okay with those.
Kind of
usually.
degenerative tear or anything like that.
Now maybe you have a couple that with a degenerative rotator cuff tear. Mm-hmm. So you start to get partial tears. Yeah.
Thinning, atrophy of the tendon.
Degeneration, maybe a couple of that with a couple cortisone shots, which aren't necessarily super healthy for your rotator cuff, which is kind of a newer trend.
Sure.
We used to do rotator cuff or subacromial injections for bursitis or rotator cuff injuries, and now we're finding that probably isn't the greatest thing for the health of the rotator cuff. Yeah. So we've kind of gotten away from
multiple,
that a little bit.
Right? Like,
multiple shots. A single shot, sure. So he's probably got more than a single, basically, as a pro athlete, right?
Sure.
So they try to, it's a symptom reliever. It's pretty effective in the short term, but so now he's got maybe a tear that's not maybe super repairable. I always tell patients, if you have a rotator cuff that's like not real healthy, and you try to repair it, it's like trying to put a stitch through wet tissue paper. It's just kind of, there's nothing to grab, and so your predictable outcome isn't there.
Very frustrating situation.
Yeah, it's hard to fix, right? So then you look at the patient and say, I'm not sure this is fixable, or you've got such amount of degeneration that there's a lot more disease than I can, take care of from a surgical standpoint.
Yeah.
And then, so you give them an option. You modify your activities, probably okay with everyday life, hanging out with his family, doing like low impact exercise, maybe doing a little bit of like body weight strength training, but probably not all right getting hit by DNs in the NFL.
Trying
They're
to throw
half
the ball
your age
50,
and
50 yards. Yeah.
throwing the ball half the way. So, what do you want to do with the rest of your life? And then, I've had a good run. I'm doing okay, and I'm
in
going
a
to
good
hang it
spot.
up.
I'm
Yeah.
done.
11 years.
The other
decent chunk of
thing
change.
that Steve brought up was arthritis in the shoulder.
Yeah.
Right.
So I hate to make this parallel, and again, it's about one that we don't have any inside information on, but my feeling on Joel Embiid is that probably fairly arthritic in there, and that's part of the reasons why he's struggling.
Definitely very.
Yeah.
I would change your adjectives.
Right.
Yeah, for sure.
Definitely very. Yeah. So I have a high suspicion of that's part of the issue here. He gets a lot of criticism in Philadelphia because he's not back.
Is he
he's
soft?
not taking care of himself.
Because he's soft?
Yeah.
Oh.
But I don't think he is. I think his knee's probably in pretty bad shape.
Yeah.
Right. And part of me wonders, is that what's going on
And
here
he's soft.
with Derek Carr, with Derek Carr's shoulder?
Mm-hmm.
Is it going down that pathway? And I don't know. Again, we don't have any access to
Right.
his but. If it's rotator cuff and labrum, like debride the labrum, fix labrum, whatever it is. If it's rotator cuff, if you have some substantial tissue to work with, go for it. But is it arthritic? Is it? And they've used the term degenerative. Is it fairly arthritic? And all of a sudden, your chances, even if the cuff is pretty good, even if you can kind of ignore the labrum, it might still be your problem. It could be one of the reasons why they were trying injections and physical therapy and all this stuff for a little while first, and he's. The chances of success of actually having a surgery might be fairly low at this point.
Right.
So if that's the case, the chances of being able to get back to going and playing, just hang it up.
I'm going to go down a rabbit hole.
Yeah.
Does the medical legal implications of some of the things that happen with the Eagles,
That's a great
case,
question.
and play into decision making for surgeons that are in the NFL to say, I'm not going to operate on this guy because he's got an unpredictable outcome.
Yeah.
He's probably got unreasonable expectations.
Yeah, and then that's on me.
And now I'm at risk.
Yeah.
So for people don't know, I mean, the Milagros case,
Yeah.
I don't remember what year it was, but it was
I forget.
a significant medical legal payout for what probably was the right
Arthritis.
treatment.
Yeah, exactly.
And I don't think they did anything wrong. And this guy had a couple things that are very common in sports. They're usually treated non-operatively or very often treated non-operatively. And he won a lawsuit that claimed that he wasn't treated appropriately, which I would on the surface disagree with.
Yeah.
But
to the layman, I could certainly see how an argument could be made to the contrary.
for people that don't really understand it.
Yeah.
Yeah. So now I feel like that may have affected decision making of NFL surgeons to be maybe less. To be more risk averse, so to speak.
That's the best way to put it. Risk averse. Yeah. To not out of desperation try Hail Mary, so to speak. Right.
Yeah.
Right, and I would imagine it would be quite the hefty lawsuit in a situation like that because this is a guy who's owed millions of dollars on this contract that he's gonna, he forfeited by retiring. I don't know, however many millions it was his deal was.
Yeah.
But you go in there and you alter his shoulder in any capacity.
Yeah.
You can't do anything return to level.
Yeah.
Right.
Then it's like, oh, you're the guy who's getting,
No.
the
And
blame.
Brandon, you went over all his history with. I mean, this is not the first time.
first injury.
So we
shoulder's
talked
been-
about that pre-show a little bit.
injuries.
His injury history is interesting as well.
23 or
2023,
20,
just two seasons ago, he had 3 separate incidences where he injured his throwing shoulder, which was just claimed to be AC joint sprains, and 2 concussions. With these kind of injuries within this whole year, and then the year after, he only plays up to December, gets hurt again, another concussion, fractured hand, and he's out an extended period of time.
Yeah.
So after a while, getting banged up is just kind of it has its toll.
That's
on
what
you.
happens.
Yeah, it gets old, and and it's definitely as being a New Orleans Saint, you're in the same conference as the Tampa Bay Buccaneers, who drafted the heaviest person ever in the NFL draft. He's like 470 some pounds. That guy's humongous. He's gigantic. This guy is down.
my.
This D lineman down in Tampa.
I was not aware
now.
of that.
Oh yeah, he's gigantic. Ironically, Tampa Bay drafted the heaviest and the lightest person in the draft this year. This guy
What was the lightest?
I forget what he was. I have to look it up.
Like
but
Bernardini light?
he might be. He might have a chance.
Yeah. It's not too late, buddy. Not too late.
It's too late.
Yeah. And
How old is Carr?
34.
Yeah, he's not a
man.
kid.
No, that's
I will look it up.
look. There's a lot. These guys go through a lot.
Oh yeah.
34.
You
Yeah.
Yeah, I mean that's a good run. I mean,
career.
it's
11 years
a
in the
rare
NFL.
it's a rare animal to be able to kind of go and become like a decades plus player in the NFL.
It's true.
Mean, the physical. I mean, so you're not just the NFL, right? So you're thinking about how many years did they play before that, right? So the same. Physical repetition, of a thrower over, and the mechanics of a quarterback aren't as dramatic as that of a pitcher.
Right.
But
ball is heavier.
Yeah. But it takes a toll, and you know what? Good for him.
Yeah.
You know.
Yeah, I'm sure it was.
He's
tough
not
decision.
forced into a surgery. He has the ability to financially settle, and and hopefully he enjoys it for a while.
And to be clear, we have no idea if the concern of litigation played into the
no,
advice
I'm
was
just
given.
again, I'm
and
just
devil's advocate,
Right.
And everything that I've read is basically he and his family sat down, he and his wife, and they talked about it, and like is it worth it at this particular point?
No.
In their minds, it's not worth it anymore, and they're done. Yeah,
that and again, like we said, we don't know, but you never know. He has a pretty good history of concussions as well. Who knows how bad that last one in December was? And he's hearing it from his loved ones and his wife saying, "Hey, look,
hang it up.
It's time. Like after that last one, you took a long time to come
got
back
the
to kind of
stupids.
normal. Like it's time to move on and take your 11-year career's earnings and live your life and go do something different.
Buy a car wash chain.
There you go.
That's what you're doing, right?
So I mean, it's interesting to see. It'll be interesting now to see what the Saints do in their quarterback room, because that's a whole nother ordeal now that their top guy's gone and they have their best quarterbacks, their tight end and Taysom Hill. But
I'm sure they're like, why didn't you tell us this 3 weeks ago?
Yeah, exactly.
right after the draft has come out, which is bad timing for people who are shopping for a quarterback. But to see what happens.
What do you think about the draft? Anybody have any? Did you guys talk draft at all, or
not really? No.
We don't have to get into that. We got
No, I mean, draft was generally pretty good.
Yeah.
Shador Sanders.
Very interesting.
A little spanking.
Yeah. Very interesting.
Spanking by the league.
Little humble pie.
Yeah.
Yep.
Did you see the lawsuit?
No.
The mystery man lawsuit.
Yeah. John Doe, huge Colorado fan, is suing the NFL. I think for like $500 million for hurting his faith in the draft because
they conspired against Shador Sanders, and it was.
How about he wasn't a gentleman?
Yeah.
Humble enough to, and you don't have to hire people like that.
Yeah.
Unreal.
Right. Well, I think there's now a lawsuit going against him because someone's upset that now they have doubts about the NFL. No. But it's just the nonsense of it.
Yeah.
Like,
wow.
Are you
It was just one of those interesting things to watch because I watch a draft usually the first round. I watch
me too. Yeah,
and it's all great. It's one night you get the good thing.
Done after that.
And then afterwards, like the second, third round, it's like if you're not doing anything on those days, you throw it on TV. If you catch your team, like
you catch the ticker tape.
Yeah, like the Eagles are on the board or like whatever.
Yeah.
And then I've noticed that I ended up watching. It's like, I got to see when Sanders gets picks now because he's still just falling, right? So it
was
became like
riveting.
a drama thing.
Yeah.
I was like, this is like too drama sappy. Like I don't want to watch.
And then you have Travis Hunter,
Yeah.
who seems like the greatest kid, super enthusiastic, willing to do whatever, and he gets rewarded for it. You know, and I don't know.
Yeah.
I actually just saw
It is interesting, and especially being a Steeler fan, like I was like right in it. Like
yeah, sure.
Like
you were.
how much is it? How much is it? Is he not as good as other people think? How much is it? His attitude and his and his approach and the circus that surrounds it.
I have a buddy that was a strength and conditioning coach for an NFL team for a long time, and so what they call them in the NFL is turds. Kids who have amazing physical talent, they're great athletes, but they're not necessarily, the most team-oriented people. They're not necessarily selfless. They're not necessarily positive influence in the locker room. And while teams will take them, it's usually begrudgingly because they don't have another option and they need an athlete in a certain position.
Yeah.
But if that team has other options, they're not going to take a person like that because they can be
destroy a locker room.
They can screw a locker room. They can be toxic, and they can create a culture that the team doesn't want to create. And unfortunately, I think that's what happened there. And I didn't mean this to be a Shador Sanders bashing.
No, and I think
because we actually don't know him whatsoever.
Yeah,
we don't know.
yeah.
No, that's another thing.
We kind of do.
Yeah, but no, and I think with that too is from what I watched on the draft coverage of like his camp was different. Like
Absolutely.
his representatives are different. He doesn't have a traditional agent, so everything was a little different. And so I think that unfortunately hurt him in the long run.
Yeah.
And I think the league was just like, well, you're going to do things your way.
Hopefully,
this is how we do our
he
things.
just like the rest of us, is when we're learning,
Humble pie.
you get spanked a little, and you say, okay, I'm going to be better for this. And he has 2 ways to respond to this. It'll be interesting to see how he responds, because I loved
He
watching him
handled
on the
draft.
field.
I will say he handled the draft part of the equation, that the whole humbling situation, pretty well. So that might be the first indication that like he got a piece of humble pie, but he is gonna roll with it and handle it.
Yeah.
And big year for prank calls on drafts. He was one of
That
them.
was
There
awful,
a
man.
couple people got hit with prank calls.
Oh, really?
It
Wasn't just him?
wasn't just him. There was a few others.
Come on, man.
But yeah, there's definitely some leaks on some phone
Yeah.
numbers and not so
Interesting.
good things.
Yeah.
I think that the leak was officially reported coming from the Falcons, I believe, or
Right,
whatever the case
right,
was.
right.
But neither here nor there. But yeah, interesting draft nonetheless.
Yeah.
Eagles took more people from Georgia, so that's a good thing, right?
Yeah,
Like,
it's always good.
It's
worked out so far.
Yeah.
it's a winning recipe.
And so to go into our last two topics of the evening, kind of late additions, honorable mentions, if you will, we'll go with the NBA. Jason Tatum last night tore his Achilles.
Yeah.
27-year-old Boston Celtics superstar, if you will, face of the franchise. He just kind of went down for a routine, kind of playing it back and just kind of go for a loose ball.
Yeah.
And kind of fell right away, almost very similar to what we talked about the last time, Damian Lillard's injury as well, same injury. And it was reported today that he already had surgery on it to fix it.
He did.
He did.
Oh, so it's confirmed.
It's
Achilles?
confirmed it was
Yeah.
Achilles tendon rupture, and then he had surgery already to fix it. So
Like the moment it happened, it was like, oh, no. Like you could, you know exactly what's going on. And it wasn't the situation where, like, I forget who the athlete was, where you see the reverberations and like, look.
yeah, the reverberations
Yeah,
like the biggest thing.
I know.
Yeah, on
So-
TV at least.
Yeah.
So I don't remember seeing that, but like you could see him go to push off, fall like a ton of bricks, and like you could see he knew exactly what had
Grab his
happened.
ankle.
He grabs it, not just the ankle, grabs his Achilles, and like crying on the court, and like because he knows like there's nobody behind him, like getting kicked
Yeah.
or that bat kind of feeling and like
Shot.
yeah. Superstar player, like really honestly, yeah. So kind
And
of
I believe
crazy.
the Celtics are not doing so great in the playoffs right now.
What
too.
a series! Holy
Yeah.
cow! I don't know if you've been watching. I grew up a Knicks fan, right? Like, and I kind of drifted away from them, but I couldn't help but get sucked back in with the series. And,
Rightfully
and,
so.
Yeah, what a series! Brunson, Jalen. Are you kidding me? The guy is amazing, and I don't think ever really got enough respect. And all of a
No.
sudden now, like, just to see him playing, to see the Villanova Knicks, like it's pretty.
Villanova Knicks.
It's unbelievable.
Yeah.
It's pretty impressive.
Shout out to the Pope.
right,
Yeah.
right.
Yep.
Seriously,
Another
seriously.
Villanova grad
Yeah.
there. Yeah.
I worry for Tatum, like in basketball. There's been a couple guys
That's
that's
a
done
tough
okay coming back, but that's a tough one to come back
Yeah.
from that
Psychologically, let alone physically.
sport. Both, yeah.
Yeah, probably easier physically.
Yeah.
Yeah.
Psychologically, that's a tough one to come back
Yeah.
from.
Yeah,
and
for sure.
I'm curious too, is like, again, we don't know his medical history, if there's something that's been bothering him or whatever the case was. But it was also something that I just thought of now is that, from the early on the games in the series, they just kind of talked about how the Celtics were just like, Jason Tatum's just going to dribble and step back and shoot a 3-point. He's not
Yeah.
driving the lane.
Yeah.
Maybe there's something underlying that we don't know
That's a
about.
good point,
And
right.
he's not taking that aggressive
He
approach.
wasn't
'cause
playing the same quite.
you
the
know,
same,
like-
maybe that's why the Knicks were
There's
able to come
usually
back
a prodrome.
twice.
I mean,
Yeah,
if you talk to people that tear their Achilles, there's usually a history they give of,
Yeah.
I've been sore, been achy, I've had a tendonitis,
Yeah.
maybe misdiagnosed,
Yeah.
hopefully never injected with cortisone. This is
Right.
another like classic no injection with cortisone area,
Right.
Because that will actually propagate a
like
tear.
the big one with cortisone and Achilles tears, like Ryan Howard back in the day, right?
Yeah.
Like that was like
Yeah.
a story that kind of had that.
Yeah.
Yeah. And complicated by infection. And
Yeah,
Yeah.
yeah.
Of course.
Which is all the bad stuff that
Yeah.
cortisone can do.
What about the last?
And then the last one would be Oswaldo Cabrera from the New York Yankees last night in the game. He was going to home plate, kind of overran the base and kind of tried to cut and come back, and in that process rolled under his ankle and just fractured dislocation.
still jumped back to the
And then still made it back to tap home plate to make it safe on a wild
very
throw from the outfield.
un-baseball player alike.
Yeah,
That was impressive.
Yeah, that was impressive because he tried to stop and go one way, and his ankle said nope, and then he's still trying to lunge and tap the home plate.
Yeah.
Yeah.
Definitely an interesting one. I think it was compared online to people like for the layman, like some similar to Dak Prescott's ankle injury, which is
Yeah.
kind of a more common or high profile ankle.
Yeah, this is
dislocation
bad.
fracture.
This is like a pronation. This is like
Yeah.
I'm sorry, eversion. Yeah, injury, pronation injury. Ugly, and
Yeah.
Ugly,
and probably gonna have a lot of rehab to do on that.
Yeah.
But since baseball players don't really have to do very much athletically, he's probably gonna be fine.
He'll be just fine.
Yeah.
But
I think he has.
I'm just kidding.
No, I think he's still he has a reasonable chance of coming back. And
Yeah,
still having-
I do too. I do
I
too.
think he's gonna have arthritis down the road.
Bingo.
Oh,
I was
yeah.
just gonna
Right.
say that. 100%.
But he'll still have a good career.
Yeah.
and I think that he's from what I didn't know much about this athlete at all, but prior to or reading up about him, he seems like one of those utility guys where he can play in multiple positions on the team, and he kind of is that guy. So
Yeah.
hopefully,
This might focus him a little bit more.
yeah,
Right.
on something. And
He's a
hope-
catcher now.
Yeah, Don't be too much. Who knows?
Sorry.
So yeah, that's kind of our docket list here, if you will. If we went down everything, talked
Good.
about anything else we want to wrap up and discuss.
No, I think it was good.
Yeah, we went over a little bit of everything.
Yes.
As always.
Well, dog walker's hip. We got to
Dog walker's
cover.
hip.
So I'm gonna research that. I'm gonna write a paper on that.
Yeah.
Get a little publication under your belt
Yeah,
there.
that'll be your first paper on dog walkers.
Sure.
So before we had to go ahead and close out our tab here, we're going to give a quick shout out to our sponsors, Virtual Orthopedics and Spine. They have you covered from runner's knee and dog walker's hip. They have a doc for that. Yardware back and laptop wrist, they have a doc for that too. Virtual Orthopedics and Spine has over 120 providers, over 20 PT and rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtual.org/ortho.
And growing like crazy, honestly.
Yeah.
Yeah.
And if you need any fracture work or trauma care, Steve Frey is
That's the guy.
our
Yeah,
new-
yeah.
he's
That's
our
the
new
guy you
Pelvic
special-
injuries.
He's
yeah.
gonna get double boarded.
Yeah.
And Neck of the Woods Brewing Company giving us the best beer. And Neck of the Woods Sourfest this weekend, May 17th, 12 to 8 p.m. here at Neck of the Woods at Total Turf in Pittman, New Jersey. And lastly, Timber Rail Productions helping us get all this media out to you folks, audio and video as well.
Just a man, Kyle.
Kyle's the best guy at it.
Miss
So-
you, buddy.
Right. No, true.
Yeah, right. So we'll see you next time, folks, and have a good one. Stay safe.